What if I told you the sentence, "It's just water vapor," is one of the most dangerous marketing lines of the decade? In this video, we will test that claim with clear science and real stories. According to the Centers for Disease Control and Prevention, no tobacco product is safe, and that includes electronic cigarettes. The World Health Organization also warns that nicotine harms teen brains and fetal development. This video is educational only and not medical advice. Please talk to your doctor before changing any nicotine use. Stay with me until the end for a practical 7-step bonus plan you can start today. Ready to look past the hype and into the evidence? You have heard the myth. It is just water vapor. Here is the fact. According to the American Cancer Society, electronic cigarette aerosol carries nicotine, ultrafine particles, and toxic chemicals like formaldehyde and metals. The American Heart Association explains that fewer chemicals than smoke does not mean harmless. Nicotine still raises heart rate and blood pressure. The Centers for Disease Control and Prevention adds that flavor chemicals can irritate the lungs and that youth exposure is especially risky. So the correct frame is harm reduction compared with smoking, not harmlessness compared with clean air. As we move on, keep this lens. Compared with what? Clean air, smoking, or complete abstinence? This lens will guide every claim we review next. Let us be real about motives. Many adults hope vaping is a safer step away from cigarettes. The Centers for Disease Control and Prevention reports that stress relief, curiosity, and social acceptance are common reasons. The American Cancer Society notes that flavors make first use easier, especially for teens who dislike smoke. The World Health Organization has warned that youth marketing and sweet flavors shape the belief that vaping is modern and healthy. In short, people are solving real problems: stress, identity, and quitting. The question is whether vaping truly solves them. Next, we will examine the addiction engine that keeps people puffing longer than they planned. Modern pods use so-called nicotine salts that are smooth even at very high strengths. According to a randomized trial in the JAMA Network Open journal in 2024, salt-based e-liquids delivered higher blood nicotine and stronger subjective effects than older free-based liquids. The Centers for Disease Control and Prevention explains that teen brains are still wiring attention, learning, and mood, and nicotine can alter these circuits. The World Health Organization emphasizes that dependence can form quickly, sometimes before daily use starts. This is why many users say, "I did not mean to get hooked." The delivery system improved, and so did the addictive pull. Next, let us see what that aerosol does to your airways. Respiratory symptoms matter day to day. A recent analysis in the Scientific Reports journal in 2024 found that electronic cigarette users reported more bronchitis-like symptoms than non-users, though increases were modest among never smokers. On the other hand, a clinical trial in the New England Journal of Medicine journal in 2019 showed that smokers who switched completely to electronic cigarettes had fewer cough and phlegm symptoms after 1 year than those on nicotine patches. The American Cancer Society cautions that vaping can still irritate airways and may worsen asthma or chronic obstructive pulmonary disease. Translation: switching from smoke to vape can help some symptoms, yet clean air remains best. Next up, the 2019 lung injury outbreak and what we learned. In 2019, thousands were hospitalized with severe lung injury. The Centers for Disease Control and Prevention linked most cases to illicit tetrahydrocannabinol cartridges contaminated with vitamin E acetate. The World Health Organization has echoed that the outbreak was largely tied to illegal products, not standard nicotine devices. The American Cancer Society stresses a key lesson: unregulated or counterfeit cartridges can be extremely dangerous. So yes, contamination was the driver, but that does not make routine nicotine vaping safe. It means supply safety matters. With that context, let us pivot to the heart and blood vessels, where everyday changes happen within minutes. What happens right after a vape session? The American Cancer Society notes that nicotine increases heart rate and blood pressure within minutes. The American Heart Association explains these spikes come from sympathetic nervous system activation, the same fight-or-flight response that strains your cardiovascular system. Some people notice palpitations or light chest pressure after intense sessions. While these effects usually fade, Repeated spikes stack cardiovascular stress over time. As we consider the longer arc of months and years, you will see a mixed picture. Improvement if someone fully leaves smoke behind, yet persistent risks compared with not using nicotine at all. Let us explore that now. Switching matters, but so does what you switch to. A study in the Journal of the American College of Cardiology journal in 2019 found that smokers who switched completely to electronic cigarettes improved blood vessel function after 1 month. That is harm reduction in action. Yet, research in the Arteriosclerosis, Thrombosis, and Vascular Biology journal showed that chronic exclusive vapors also exhibited impaired endothelial function similar to smokers, indicating ongoing vascular stress. The American Heart Association summarizes it well. Fewer toxins than smoke does not equal cardiovascular safety. If you do not smoke, do not start vaping. If you do smoke, complete switching may reduce harm, but the end goal should still be nicotine freedom. Next, we head to your mouth. Your mouth is the front line. The American Cancer Society reports growing evidence that frequent vaping is associated with gum inflammation, enamel erosion risks, and shifts in oral bacteria. Sweetened liquids and dry mouth can raise cavity risk, especially with constant sipping-style vaping. Dentists increasingly advise treating vaping like smoking in terms of dental care habits, regular cleanings, fluoride, and reduced frequency. Short version: your gums and enamel prefer clean air and water. From the mouth, let us move to a crucial population where risk tolerance should be lowest: pregnancy. Nicotine exposure during pregnancy is never a safe bet. The Centers for Disease Control and Prevention explains that nicotine restricts blood flow and can impair fetal brain and heart development. A systematic review in the BMC Pregnancy and Childbirth journal in 2024 found no convincing evidence that vaping in pregnancy is clearly safer than smoking. The data are limited and confounded by prior smoking. The World Health Organization advises pregnant people to avoid all nicotine and to quit with clinician-guided methods. If you are pregnant or trying to conceive, talk to your doctor about nicotine replacement or prescription options that do not involve inhaling heated chemicals. Next, what about the people standing nearby? What you exhale can still harm others. The United States Environmental Protection Agency reports that indoor vaping increases ultrafine particles, volatile organic compounds, and nicotine in room air. The American Cancer Society notes that the Surgeon General warns e-cigarette aerosol is not harmless to bystanders, including children and people with asthma. The Centers for Disease Control and Prevention recommends keeping homes and cars 100% smoke and vape-free. Practical tip: make a house rule of no vaping indoors, set a polite script for guests, and use outdoor spaces only. Now, if someone wants to quit cigarettes, where does vaping fit compared with proven tools? Let us put results first. A trial in the New England Journal of Medicine found that electronic cigarettes helped more adult smokers stay smoke-free at 1 year than nicotine patches. The Cochrane Database of Systematic Reviews journal in 2025 concluded with high certainty that nicotine electronic cigarettes increase quit rates compared with nicotine replacement alone. The best outcomes happen when people switch completely and receive coaching or counseling. If this kind of practical, evidence-first content helps you, please subscribe and tap notifications so you never miss the next science-backed guide. Next, a warning about dual use. Many people vape and smoke at the same time. The Centers for Disease Control and Prevention warns that dual users may take in more toxins and gain fewer health benefits than people who choose one product. The American Heart Association advises a clear plan. Quit all cigarettes as fast as you can, then step down your vape nicotine and frequency on a schedule. Behavioral support matters here. Even brief counseling improves success. We will tackle a tough question now. Does vaping pull teens towards smoking later? Across countries and cohorts, a consistent pattern appears. The Centers for Disease Control and Prevention reports that teens who vape are roughly 2 to 3 times more likely to start smoking later than teens who do not vape. The World Health Organization emphasizes that high nicotine pod systems and sweet flavors raise the odds of later combustible use. While some scientists argue common risk-taking explains both behaviors, multiple longitudinal studies still show a strong association after adjusting for known confounders. Bottom line, prevention in youth is a public health priority. Next, we will look under the hood at devices and flavors. The tool shapes the dose. The JAMA Network Open Journal trial in 2024 showed that pod systems using nicotine salts can deliver nicotine as rapidly as cigarettes. The Centers for Disease Control and Prevention explains that high wattage or high temperature settings can form more aldehydes like formaldehyde and acrolein. The American Cancer Society notes that certain flavoring agents, including diacetyl, have been linked to airway irritation and serious, small airway disease in workers when inhaled. Translation: device, settings, and flavor chemistry matter. Safer does not mean safe. Now, let us cover practical hazards people rarely consider. Batteries can fail. The American Cancer Society has documented burns and facial injuries from exploding devices and improper charging. Liquids can poison kids. The Centers for Disease Control and Prevention tracks thousands of calls each year, most involving children under 6. The World Health Organization advises avoiding counterfeit or illicit cartridges entirely, especially black market tetrahydrocannabinol products linked to the 2019 outbreak. Safeguards: use the original charger, store liquids in child-resistant containers, and never buy mystery refills. With safety in mind, what about the planet? Disposables do not disappear. The Truth Initiative reports that electronic cigarette waste contains plastics, heavy metals, and lithium batteries that often end up in landfills or as litter. Leaked nicotine and metals can enter soil and water over time. Municipal recycling programs rarely accept mixed cartridge waste, which means the environmental cost is paid by communities. If you currently vape, seek electronics recycling for batteries and reduce single-use products. Next, the rules of the road and how agencies are responding. In the United States, the Centers for Disease Control and Prevention highlights age 21 sales laws, restrictions on certain flavors, and the Food and Drug Administration pre-market review for products seeking authorization. The Food and Drug Administration has not approved electronic cigarettes as quit-smoking medicines. The World Health Organization notes that dozens of countries restrict or ban electronic cigarettes, prioritizing youth prevention and the precautionary principle. For families, the takeaway is simple. Treat vaping like a restricted adult product, not a harmless gadget. Coming up, your step-by-step bonus plan to get free from nicotine. Here is a practical roadmap. Step 1. Set a quit date within 2 weeks and tell one supporter. The Centers for Disease Control and Prevention says accountability helps. Step 2. Choose proven tools such as the nicotine patch plus short-acting gum or lozenge. The Cochrane Database of Systematic Reviews Journal supports combination therapy. Step 3. Remove triggers at home, in the car, and at work. Step 4. Schedule replacements like walking, deep breathing, or texting a friend. Step 5. Call 1-800-QUIT-NOW for free coaching. Step 6. Consider varenicline or bupropion with your doctor if nicotine replacement is not enough. Step 7. Plan for slips and restart fast. Next, the big takeaways and a final boost of motivation. Here is the truth. According to the American Heart Association, vaping is not harmless. It simply has fewer toxins than smoke. The New England Journal of Medicine journal shows vaping can help some adult smokers quit, but only with complete switching and support. The Centers for Disease Control and Prevention and the United States Environmental Protection Agency make it clear that clean indoor air means no vaping at home, in cars, or at school. Your best health future is nicotine freedom, and you can get there with a plan. If this documentary-style deep dive helped you, please subscribe and share this with someone who needs a science-based push. Comment below with the next health myth you want us to investigate. And remember, small steps today become big wins for your lungs, your heart, and your life.